time. You're most welcome. And now, it's the Arab state, the League of the Arab States. So thank you again for coming today. Out of your responsibility as an Assistant Director General and Regional Representative for the Near East and North Africa for health. So, what are the latest achievements and the future plan till the end of 2030? I'm linking that, with the SDGs. So, when it comes to food safety, we are concerned mainly with direct, would say, goals: zero hunger, good health and well-being, decent work, and economic growth for the first time.
أولا السلام عليكم جميعا، مساء الخير وشكرا للاستضافة الكريمة. Let me start by maybe putting a bigger picture of where food safety lies in the bigger map of food security. And when we talk about food security, we talk about securing food for any community, any country, any region. There are key pillars. I summarize them simply in what I call the 4 A's. The 4 A's are pillars of any food security system. One is food availability, and the availability is either from your local production or from your import from outside. And the second is your food accessibility. That's where you make food accessible to every citizen in the country or the community. And the third, and that's very important, is the food affordability, and this is where the subsidies and the prices bring the food down so that the low-income ones can afford to buy healthy diets. The fourth and the most important is the food adequacy, and this is where we need food safety and nutrition. So these are the two major components. So you have to make sure that food is available, accessible, affordable, but also healthy diet and also safe for the consumption. And each of those components will require its own strategy and its own policy at the national level to be able to tackle it properly. The biggest challenge that we have today in an open world is that trade adds a more complication to the food safety aspect. So you need to make sure that the standards and the specifications among countries are kind of harmonized in a way that facilitates trade, but also does not allow unhealthy diets to be transferred across borders. That is the biggest, besides what my colleague just said about having the internal capacities of laboratories for monitoring and control, you would still have a challenge to also make sure that the food that's imported from outside is also safe and healthy. Now, globally, on the SDGs within the Arab region, what we call the Near East and North Africa, we have about 66.1 million people of the total population, which is affected by severe hunger. And here we mean about hunger as a definition of the SDG 2 on the Agenda 23, where people either do not have access to food or do not have access to safe and healthy diet. Healthy diet in particular has increased in cost above the average people. The average cost of a healthy meal today is about $4, exactly $3.7 per person per day. And that is too much for an average income family. Now, from our perspective, is that what we call the foodborne diseases that come where you don't have a safety or food safety system that protects the safety of food cost us high figures. We have 420,000 people in the Arab region itself are affected annually by the intake of unsafe food. Out of those 120,000
reported cases only.
Yeah. Exactly.
These based on 31 hazards of more than 250 hazards.
You are very right.
Yeah.
And out of those, 125,000 are children. What is astonishing, the cost that comes with this. It's a very high cost. Globally, we're talking about billions of money that is lost, an average of 95.2 billion annually is lost on the foodborne diseases. Yes. And this is direct and indirect, including the loss of workforce and all the related trade diseases. And the annual cost of treating foodborne diseases goes up to about $15 billion in the region. So these are high economic demands for the countries that can save for other parts of the economy if they invest very well on a comprehensive food safety system that protects their citizens from intaking unsafe.
Very true. So, how do you evaluate the achievement of your unit, I mean, in the FAO, concerning this point in the region, Near East and North Africa?
Now, what we do at FAO Global, you will know the Codex Alimentarius. The Codex Alimentarius was established in 1963 between FAO and WHO, and it is to set up international standards for food safety all over the world, which is used today as the best benchmark model for the countries to establish their own national standards, and this is where the laboratories use them for their reference to monitor the safety of food. And that's one important step that FAO provides to the countries. We provide food support to delegations, trainings, and capacity buildings of how to develop their own national standards, but also how they can benefit from the Codex Alimentarius. We also have a joint program with WHO, the International Organization for Animal Health, and UNIT on the One Health. And today the One Health looks at the human health, the animal health, as well as the environmental health. And how can we make sure that this One Health concept is well established at the country level, because they're all interrelated, including what kind of drugs, for example, the antimicrobial resistance that we give to the animals to overcome some of the diseases that are across the livestock that will have an impact on the safety of food to the human beings. So we connect now the discussions between FAO and WHO to help the countries have a more wider understanding of this One Health concept by bringing the Department of Agriculture or the Ministry of Agriculture and Animal and Livestock together with the Ministry of Health, together with the education and the regulatory authorities on food safety, to make sure that they have a one view and one vision of how they tackle the food safety from all perspectives, including from the food from the farm level to the table. The other aspect that we just came now recently as an initiative from FAO, we have already established a regional food safety research network, and this includes the Arab region and Africa. So this is connects Africa with the MENA region, and it's a wide network of bringing all the food safety research institutions together, at least one from each country. We've already financed the whole process. We've launched it last year, and we were active in the Africa Food Safety Agency's conference that took place in Egypt last year, and we're working closely with all the food safeties to establish this hub for them to exchange experience and benefit, because we know some countries are advanced in food safety and some countries still do not have the basis of food safety systems in the country. So we wanted those to speed up their building of the systems.
Actually, my question is about how, I'm talking about the percentage. So, the SDGs, the announced SDGs started at 2015, and the main aim is announced 2030. So, within this region, how do you evaluate the achievement from 15 till the moment, and what do you think about 2030? Especially, there are some announced targets. So, are we close to these targets nowadays? We are at 2025.
Now, a simple answer, no. And it's globally and worse regionally, both MENA region and Africa region. Both are not on track for achieving SDG 2000 by 2030. What is worse, and sad to say, the latest indication, and we monitor this on a regular basis, we issue an annual report on the status of food security and safety in the region, both in Africa and MENA region. What is worse, the trend is even getting worse. So we are actually deviating even further away from the targets. The trends of 2023 and 2024 is worse. There are two major factors that are affecting this. One is conflicts, the increase of conflict, because 90% of those who are affected by lack of food safety and hunger in general are in the conflict zones. We're talking about Sudan, Yemen, Gaza, Lebanon, Syria, but then you go also the rest of the continent of Africa. It's getting worse and worse. And the reason is that these conflicts are also becoming protracted. We are used in the past to conflicts that would live with us for a couple of years. Now we're talking of conflicts that are going for decades, 10 years and 20 years and more. And that destroys the whole institutions you have within the state to be able to monitor your food safety, because you need the stability, you need to build capacity to be able to consistently and continually monitor that food safety.
For that, so I highly appreciate your words. Now, actually, you are most welcome, Dr. Ali Badarna. So I hope you will continue this one, this part concerning UNIDO responsibilities. Out of your role as an expert and chief of the food security, the same topic, and food systems, which is I like this word a lot. Division at UNIDO, and concerning the food safety and market system development. Kindly brief us about the upcoming priorities for UNIDO to develop the Arab and Africa food industries commerce. And of course, out of your role, I'm talking about UNIDO role and responsibility in this region.
Thank you so much. I think Dr. Abdul Hakim nicely gave this umbrella understanding of how the food security is a complex topic and food safety is one of the key pillars. So maybe also before I answer the question, it's good to explain how you need to fit into this picture. Because as you can imagine, we are the Industrial Development Agency of the United Nations system. We're not part of the food and agriculture system. But we believe we could complement the efforts of the rest of the UN system when it comes to food safety. And in the way I would like also to describe it, I think also the Dr. Ola from IEA, she talked about the analytical capacities and the lab capacities that are needed as a building block for any functioning food safety system. And with the support of FAO and WHO, all the legal framework, the risk assessment, the standard setting are actually the foundations of any functioning food safety system. So if you think where UNIDO fits in this whole thing, it's actually two main aspects. We believe in this concept of the food safety is a shared responsibility, not only within the country where the private and public and academia and others have to work together, but also within the UN system. We believe within the UN system it's a shared responsibility. So if you think of UNIDO as the representatives of the industry, specifically the food industry, so we have a kind of responsibility to contribute to the food safety systems that are being established by governments. The approach we take is actually to get the private sector having an active role in the setting of a food safety system, whether taking part of the standard setting, taking part of any initiative, and being on the table when the government is actually designing their food safety system. That's number one. Number two, to try to support their efforts in complying with whatever standard or requirement that comes out of the national standards that colleagues from WHO and FAO are helping this country to establish. The third and most important, in our opinion, is actually to go even to the next step, which means that how the private sector could contribute in investing in building the national food safety system. I always like to give the example of Austria, where I live. Austria is a small country, and if you think of the operational budget of the National Food Safety Competent Authority, how much it costs the government to maintain a food safety system. I recall 3 years back, their annual report was almost up to 195 million euros. It's a country which is only 10, 11 million population. So if we reflect this to Africa and to the MENA region and try to pick one country and say, can you develop your national food safety system according to the FAO WHO guidelines? Yes. How much does it cost? How long it takes? So if I benchmark with the example of Austria, and we take a specific country without mentioning names, it will take hundreds of millions of euros, and maybe with a situation that you can't explain, it will take 10, 20, 30 years. Then the question, can the private sector, the exporters, the farmers, the industry, can they wait until the country have a functioning food safety system? No, because trade will continue, economic development need to continue. That's what we try to get the private sector take an extra step, be part of the investment, be part of the responsibility, try to take part of some of the functions of a national food safety system. Not necessarily the legal ones, the standard setting ones, but maybe on the compliance capacity side. I will not go through examples of UNIDO, maybe we leave this a follow-up question. But let me close by another aspect where we believe that accelerating food safety compliance in Africa and in the region is critical with regional integration. If Africa or the Middle East, they don't work together, they are going into the dark.
Thank you.
Their investments will not be really efficient. And this is where I think Africa is doing interesting steps about the integration. Good luck, it's complex. In the Arab region,
There's some efforts on integration through the League of Arab States, through AOD and EDMO, but I think this needs to be accelerated. That will save lots of time and investment on the countries to reach their targets.
Thank you very much for that. Although these regions now, it's always about who would be the most, you'd say, needy region for such aids. I mean, from the rest of the world. The developed countries, for example, the climate change. Who has done that? I mean, most probably the industries, and the industrialized, you would say, countries around the globe. And now within the UN organizations, these need to be backed for, the rest of the world who did not maybe contribute that much in the climate change and the consequences happened accordingly. So, I think we should not think about this point as aids. No, they have to pay back, for this world, I think so. So maybe it's negotiation point, I don't know. But still, what to do? Do you evaluate that? Although I know that UNIDO is doing actually a good job through some projects, I know. But do you think that this is enough for this region, for the, Africa and the Arab world?
It's never enough. Food safety is a science in motion because things are changing. You mentioned the climate change. With the climate change, the food safety hazards are changing.
Yes.
New things are coming up. So it's not a still topic that you always need support, you always need investment, and there's nothing enough. And I don't think even if you talk about Africa, yes, they need support. But even Europe is requiring support because things are really changing. And again, global cooperation save time and money. Regional integration again save time and money. Otherwise, it will take us ages until we get where we need.
Thank you actually for highlighting the word African cooperation. To welcome Ms. Wenta. You're most welcome in Egypt. And the question, I would say, actually, it went this way, and I think we should end to these points, although we'll get back to the National Food Safety Authority question after that. Dr. Amr has come. So, Dr. Ms. Wenta, out of your responsibility as a program manager for the African Union, we are relying on that. So, and in the context of the limitation of the infrastructure and the food safety challenges in many African countries, what would be the opportunities for future binary trade within the country?
Thank you very much for the question, and first of all, thank you for inviting us to this important meeting on food safety. I will speak from the continent's perspective and the Commission's perspective on food safety. So we view it as not only a health issue, but also a critical issue for agriculture and trade. So over the years, the African Union Commission has been trying to help member states in various ways, and it's been doing that through its various initiatives and programs that it implements at national level and also at regional level. The first of its kind is actually the establishment of the Partnership for Aflatoxin Control that almost everyone kind of knows. This is a program of the African Union really looking into aflatoxins in member states. So this program was piloted in 6 AU member states, and we were able to assess the contamination levels in various crops, staple crops in those countries, and being able to establish some kind of trend. And over the years, we were able to get a lot of data on contamination levels in countries. So over 9,000 samples were analyzed, and currently the Codex is using this data to develop standards for the continent, actually in these specific staple crops. So following that, in 2018, the AU decided to actually scale up the work, not only focus on aflatoxins but food safety in general, but also scale up in terms of countries. So we supported more countries in developing food safety master plans, etc., for food safety systems. Then this is also aligned to what we've been all talking about, the African Continental Free Trade Area. So the adoption of the Continental Free Trade Area was in 2018, and this is actually a possible game changer for the African continent, where there is a market of 1.3 billion people and a GDP of $3.4 trillion. So for agriculture and food, this is actually the best opportunity because the agriculture trade is expected to increase by 500% by 2030. Over 75% of all intra-African trade will be in agricultural products. So food safety is really the central, a key component to making the AFCFTA, achieving the AFCFTA. So also in 2019, we developed the first of its kind Africa Food Safety Index. This is an index that has never been done, whether globally or elsewhere. So this index enables us to assess actually what exists in countries in terms of food safety systems, also in terms of health impacts and trade impacts. This is being used by others like the WHO and others to develop actually a global food safety index. So this is an innovation that has been done by the African Union Commission. And additionally, we also developed the Continental Food Safety Strategy for Africa in 2021, which will take us for the next 15 years. It focuses a lot on enhancing health on the continent, but also improving trade competitiveness in global markets for African countries. Additionally, as recently as this year, I've seen my colleagues mention it, the Africa Food Safety Agency has been established through the African Union. So this agency will be able to coordinate at continental level all food safety policies, standards, etc. At continental level. So this is a really big achievement for the continent. And also going forward, it will be able to support member states in all these areas. So looking forward, we are finalizing the Malabo Declaration, and this is the Comprehensive Africa Agriculture Development Program strategy in implementing agricultural issues. But now we have the new Kampala Declaration that starts 2025-2035, which makes food safety one of its key components. So food safety is being really addressed through the African Union to improve competitiveness of African agriculture and also intra-Africa trade on the continent. Yes.
So you could call this like we have now African food safety legislation.
Agency.
Yeah, I mean, so it will, set the requirements inside, okay, and outside, of course. I mean, between the African continent and, other, you'd say, trade partners.
Absolutely.
Okay, you have answered the next question for me, which is about the achievements, and thank you. There is something good to rely on. And I think actually, thank you very much for your answers. Where you have actually shown clearly the situation internationally. So, and this is actually would clarify, you would say, the claim that we should work on internal, you would say, cooperation, African, Arab-African cooperation. So, thank you very much. I highly appreciate that. If you have something else to share concerning the achievements, it would be great.
One other issue that I actually forgot to mention is the AFRA, is the African Forum for Regulators. It's an African, I kind of forgot the name, but Regulators Forum, which is the General Assembly of the agency. And it was actually, its initiation was in Egypt as Dr. Hakim,
participating member state, and in that case, like whatever we provide, it will be in equal way.
So the first step starts from the member state or
Yes,
the region itself?
Exactly,
Okay.
exactly. Yeah, because let's say you go to the doctor, you don't say, I'm just ill, I'm just sick. You have to identify exactly where's your pain. And that's what the IEA is doing. It's listening to the member state, what's exactly their needs. And here it becomes like whatever they are providing is more valuable. Like we're not providing anything, we're providing exactly according to a gap analysis and according to study coming from experts in the same area.
You know, because this is, linked to the headline of today, strategic priorities for health, confidence, and commerce. So, of course, when we do so, we make sure that, our laboratories and, such, what you are actually doing, this will, of course, reflect on the commerce by the end of the day and actually improving the exports, for example, in the Africa in general and Arab world. Thank you very much for that. And hopefully we will do more and more because I think we still need more concerning this one. Thank you.
Thank you so much.
Thank you.